For the first time, the FDA has authorized fruit-flavored e-cigarettes intended for adult smokers. It's a major policy shift that has some health groups and parent organizations worried it could drive more underage vaping. Joining us now is CBS News medical contributor Dr. Céline Gounder. She's also the editor-at-large for public health at KFF Health News. Dr. Gounder, thank you so much for being with us. Can you walk us through this policy shift and the timing of it? Why has the FDA decided to authorize this use now, and what's the difference between authorization and approval?
The FDA in the past had rejected over 1 million flavored vaping products, and teen vaping had in fact hit an all-time 10-year low. In February, the FDA's own staff, chief staff, said that they needed more time, but that then the Wall Street Journal reported over the weekend that Trump had scolded him for moving on this too slowly. I do think it's important to qualify authorized, as you were asking, does not mean approved. It means that the FDA decided that this could help some adult smokers switch from regular cigarettes to vaping, and that the age restriction would be enough to keep children away from these products, but it doesn't mean that these are safe.
Dr. Gounder, health groups and parent organizations have long pointed to flavored cigarettes as a gateway to tobacco cigarettes for younger users. How are vaping companies pushing back on all of this?
So teens who vape are about 3 times as likely to progress to smoking regular cigarettes as other teens. The industry says, well, these kids would have smoked anyway, but there's no way to prove that. And they argue that vaping helps adults quit. But most young vapers have never smoked cigarettes to begin with.
So what are the guardrails here? Is the FDA going to use more restrictions and limit the availability of these products to young users?
So this particular device requires a government ID scan, and it pairs with a phone. So, and then furthermore, ads are meant to be targeting adults 21 and over. But we haven't really seen this tested in wide use, so don't know how well that system will actually work. The tobacco industry has made campaign donations to the Trump campaigns, and they gave money towards building the White House's ballroom. The head of the FDA's tobacco office was fired by this current administration. A former tobacco executive is now in a senior role at the CDC, and most of the CDC's smoking prevention staff have been cut.
I want to make sure we get to this, because what are the major health risks associated with vaping, especially underage vaping?
Vaping can cause harm to the lungs and to the heart. It can raise your risk of asthma, chronic lung disease, blood pressure can go up, increase your risk of heart attack or stroke. Nicotine is addictive, whether it's through a cigarette or through vaping, and teen brains, we know, are more prone to addiction. Longer term risks, like whether vaping is associated with cancer, we just don't have that data yet.
Dr. Céline Gounder, thank you so much.